Hi everybody, it's Jenny from MedEd again, your CNA instructor. So before I show you how to empty a urinary drainage bag, I just want to go over real quick the anatomy of a catheter and basically how it works. So there's different parts to the catheter. This part is the part that the nurse, because it has to be a nurse, CNAs do not insert catheters. A nurse puts up into the urethra. Now it's the same boy versus girl, a urethra is a urethra, and yes, we do have different sizes. This is about the standard size, but we do have smaller and bigger depending on the resident. When the nurse puts this up into the urethra, the nurse is going to inflate a valve. Now, I'm going to fill mine with air, but when we're doing this in the clinical setting, we fill this with saline. So once it's up into the bladder, the nurse inflates a valve to keep it inside the bladder. Otherwise, when the person stands up, it would just fall out. So, this is the bladder, and then this is the valve anchoring it up inside the bladder, because your bladder's got some room, but your urethra does not. This valve is what we have to be very careful with. If you pull that out, I've seen penises ripped, I've seen vaginas torn. You've got to be careful with these catheters. Now it does take a heavy hand. Okay, so just, pulling like so is not going to yank it out. But if the bag's on one side of the bed and you get the resident up on the other side of the bed, it gets yanked out. If the bag is attached to the frame of the bed and somebody puts the frame down, it pulls it out. So you just need to be aware of your catheters. Now once this is inserted, this part gets attached to the actual catheter bag. So this part of the catheter is up inside the resident's body, and then we see this part coming out of the urethra, draining down a tube, and collecting into some type of a drainage bag. And every facility has their own types of drainage bags. So catheter care should be provided at least on every shift. I kind of talked about it in Bad Bath, but just to kind of go back over it. When you're cleaning a catheter, so we'll pretend that this is a lady, a vagina coming here, you hold the catheter with one hand, obviously you would have gloves on. Hold the catheter with one hand, and you wipe away from the body about 4 inches. So away from the body, never up toward the body. If you push it up toward, then we're just putting bacteria and such up into their urethra and giving them horrible bladder infections and urinary tract infections and possibly sepsis. So I just kind of wanted to show you the anatomy of a catheter and how a catheter works before I go over the procedure. So I'm going to get my stuff ready and I'll be right back with you.